Hello there, my name is Neil and I'm one of the dentists here at Skirker Green Dental Practice. Thank you for joining me on this video. Today I'm going to talk about what your options are if you have a missing tooth or missing teeth. So let's find out just what they are. So the first question maybe is, why replace missing teeth? Appearance is one very obvious answer. It's far less acceptable these days to have missing teeth, and especially if those spaces are in our smiles. Smiles are very important, not just for communicating with people, but for our self-confidence. Now, function might be another reason to replace teeth, and certainly missing teeth can slow down or make it more difficult to chew, or even stop you from eating certain foods. Now, what happens when a tooth is taken out is that the teeth either side start to tip into the space, and the opposing tooth, that now no longer has anything to bite against, starts to drift either up or down into that space. Now, this movement makes those teeth more prone to decay, and because they start to meet differently in the bite, it can cause jaw joint problems to occur later on. So what options do we have? Well, dentures can be used to replace single, multiple or even whole sets of teeth. They can be supported by gums, by teeth. They're a removable option and should always be taken out at night, but they can look great and can be quite a straightforward way of replacing teeth. Now, one trouble that people often have with dentures is that they often move, especially lower ones. Food can get caught underneath them, or some people unfortunately experience their dentures dropping whilst they're talking, which can be very embarrassing. Now, it's worth bearing in mind that dentures aren't teeth. They are a prosthesis, and much like a prosthetic arm can be made to look like an arm, it isn't a replacement limb. So dentures can take time to get used to, and there is an acquired skill to using them. Now, our next option is a bridge, and bridges are fixed to one or both teeth either side of a gap. We have conventional bridges which have a false tooth fused to a crown or two crowns on either side of the space, or we have adhesive bridges, and these use a metal plate with a false tooth suspended from it, and they're stuck to the back of one of the teeth either side of the gap. The main difference between these two types of bridge is that conventional bridges require a lot of drilling, but they stay on pretty well. The downside is that all that drilling sometimes leads to the nerves dying in one or both of the teeth, and that can require root treating later on. With adhesive bridges, there's very little or no drilling at all. Cement here is the weak gap, and occasionally, unfortunately, it will fail. The upside is that usually you can clean up the bridge, remove the old cement and stick it back on. Now, this brings us finally to dental implants, and dental implants are a great way of replacing teeth. They are fixed, they look good, they can be, you can eat with them and smile with them just as you would your own teeth. And if you want to know more about dental implants, then please have a look at our video titled Pros and Cons of Dental Implants. Well, I hope this has been helpful, and I'll see you in the next video.